Hello and welcome to Health Matters. I'll be your host, Dr. Chillemi. In today's episode, what we're going to talk about is understanding arthritis. I'm going to make this a series, actually. So this will be episode 1 in the series on arthritis. We're going to take an in-depth guide with natural solutions. So what I want to do is I want to delve into certain health topics which can help you take actions today. We're going to talk about arthritis, and I'm going to go over a few different ones, but then I'm going to really break them down in the series. So typically, arthritis affects tens of millions of people every single day worldwide. This is not a local problem. This is a person problem, especially as we age. It's one of the most common conditions that affects everybody. It doesn't discriminate in any level. Everybody's susceptible to it, especially as we age. So what is arthritis? So typically arthritis, the definition is it's an inflammation of the joints that can cause pain and stiffness and swelling in one affected area or multiple affected areas, whether it's your knees, your shoulders, your fingers, your back. It can affect a lot of different things. Common symptoms of arthritis are joint pain, stiffness, especially stiffness in the morning, swelling in certain areas. Sometimes maybe you wake up and you can't get your ring off your finger, or if things feel a little bit tighter, your joints are swollen. Reduced ranges of motion, decreased motion. Maybe your fingers or your knee can't move as well as it should, right? We have arthritis and they're causing problems for you to have the ability to move. Redness in the joint as well. So sometimes when we have swelling, we have associated redness with it. So there are several different types of arthritis. The big four that I'm going to delve into this series is going to be osteoarthritis, psoriatic arthritis, gout, and what I'll call a blend of other conditions, specifically rheumatoid arthritis. So osteoarthritis is typically the most common cause or the most common type of arthritis, especially as we age. Gender, usually it's more prevalent in women, but it doesn't discriminate against us either. Usually it affects your joints. Any type of previous accidents or surgeries can increase it. Obesity, extra weight, putting stress on the joints is a huge factor in what osteoarthritis is. And it typically is the result of wear and tear of a joint. So it's if you are injured and now you're not walking correctly, your biomechanics are off, you're changing your body's balance, you're going to wear your joints out in a different manner. So I know in my office, I see a lot of knee patients that have osteoarthritis, and they'll typically wear one side more than the other. Then when that side gets bad, what'll end up happening is that patient will actually start favoring the good side. And what happens in a rapid manner is that good side that wasn't bothering you over time does bother you and actually can become worse than your original worst side, right? Because the change in your biomechanics is causing you to have a change in your function of your joints, right? So we all have a normal gait pattern, normal function pattern, normal movement pattern. When we alter that pattern from injuries and or conditions, we change the way we walk, we change the way we sit, stand, bend, move, lift, everything. So in in talking about arthritis, it is key to understand that didn't happen 1, 2, 3, right? It's a slow buildup over time. It's a slow buildup over time. Maybe what I see a lot now is patients in their teens and early 20s get into an accident. They didn't think anything of it. They really, oh, it was a small impact. I didn't really, or I fell here, did this. Really wasn't that big a deal. But was it? It actually was. Why? Because even though they didn't feel anything then, they changed some of their biomechanics. They maybe strained their ligaments. They never healed properly. And because of that, now they've changed their gait. Even if their gait is off 10%, 15%, it changes. So as we continue to age, the ability of your body to function properly and move in the same normal biomechanics of how you are supposed to move, it's changed, it's altered. So once you alter your gait and you alter your function, your joints will alter as well. So what we have to do is we have to treat that, right? So, and usually you don't notice it because it doesn't bother you in your teens and 20s or even early 30s. Maybe it starts to creep up in your early 40s. And then by the time the 50s and 60s comes, look, oh, I didn't even do anything. I woke up and I got this pain. Now I got this. Oh my God, I got all this arthritis. How'd this happen? It's happened over time. Just like if you ever look at history and how they see rocks change over years and years and years, right? Wear and tear of the weather affects rocks. Wear and tear on us, on our joints, affects the joints. And then it wears, and then it wears, and then it doesn't wear correctly, and then it causes dysfunction. So then we have to treat it. Okay, so some of the things I'm going to talk about now are I'm going to go over osteoarthritis, and I'm going to kind of get into some pretty good detail about osteoarthritis and what it is and what we can do and some of the treatment options we have. But let me explain to you a little bit in depth on osteoarthritis. I already said it, it's the most common form of arthritis. It's usually classified into 2 different categories. And usually it affects you with decreased loss in function in the joint and decreased motion and pain. Clinically, symptoms always vary. Everybody's a little bit different, from patients who are asymptomatic and we just happen to take an x-ray and we see it, or patients who are disfigured where the joint is actually expanded and grew abnormally to one side. And then sometimes we see them where it actually affects patients' permanent disabilities, where that arthritis is so strong, it affects that patient ability to do anything. So typically in normal joints, the hyaline cartilage covers the ends of the bone and provides a smooth surface. So smooth surface so we can glide, right? It's literally the smoothest surface on the planet, actually. That's how smooth it is in our body. That's why we can bend our knees without having pain. That's what gives us that ability, that hyaline cartilage around there. When we have our osteoarthritis, it affects the hyaline cartilage. So the hyaline cartilage acts as a cushion between the bones. That's what you should think of it as, a cushion between the bones. So in osteoarthritis, the cartilage breaks down, causing pain, swelling, and problems moving the joint. Usually it worsens over time. Bones may break down and develop what we call spurs. So a spur is if you have a normal bone, then you have maybe a little something popping off at the end of the bone. It grew because of the arthritis. So our body is really, really smart. And what it tries to do when you have an injury or a defect it tries to balance it out. So what the body is attempting to do is rebalance you out. It's smart, but it doesn't make you that smart where it causes a permanent defect in there. So that spur that was not supposed to be there, now it's there, and it was there to attempt to help balance you. But what the end result is, it left you with an extra piece of growth. That's what it typically does. It leaves you an extra piece of growth. And sometimes what happens is when those growths irritate your cartilage, pieces can break off, and that causes pain and inflammation. So in the body, the inflammation process happens, and your body has cytokines and enzymes which are released when your body has an inflammation process, which causes more damage to that cartilage. The more damage you have to the cartilage, the more osteoarthritis you typically have, the more decrease in function you typically have, the more decrease in motion you typically have, and usually more pain. It is up to us to see these beginning signs and get treated early. Most people say, oh, I don't want to do this, or I don't want to do that. I'm young, I don't need this or that. But you do need it. You need to start as early as possible to get your body on the best track in your 20s and 30s. So when you're in your 40s and your 50s, you're good. And then when you're in your 50s and 60s, you're good. And when you're in your 60s and 70s, you're good. Listen, we're all going to age. Everybody's going to have some form of arthritis as you get older. It's just the way it is. But you don't have to accept deficits or inability to function. It doesn't have to be that way. In the final stages of osteoarthritis, the cartilage wears away so much you are rubbing bone on bone, which leads to rapid joint deficits and severe pain. Osteoarthritis, this disease process, not only affects the articular cartilage, but it involves the whole entire joint, including the subchondral bone, the ligaments, the capsule, the synovial membrane, ligaments, and muscles around it as well. Ultimately, the articular cartilage degenerates and causes fissures to happen. Fissures, ulcerations, full thickness loss, change in your joint surface. That's typically what happens with arthritis. So some of the clinical signs of arthritis that affect the joint are really talking about motion. That's usually one of the first things that we see in practice. And that's typically the mechanical type of pain, right? So it's generated as we mobilize, as we move the joint. We're bending, we're going up and down the stairs. So that's usually one of the big signs. Going up and down the stairs, I can go up and down the stairs, but I can go up, but I can't go down, right? Because those ligaments have worn, and the ability for your ligaments to function properly as you're going down the stairs and stabilize you had been altered because of the arthritis in there, and because it's affected your ligaments now. It's affected everything in there. Typically, the mechanical type increases with motion and makes you tired. Your legs can feel tired and heavy. And typically, it decreases with rest. So once you rest it, it feels a little bit better. That's typically the mechanical kind. The intensity of pain usually varies. Some is dull and tolerable. Others, it's severe. Cold weather, trauma and fatigue increase it. So I'm in New Jersey. We just had a good snowstorm yesterday. Patients yesterday, definitely more pain. Cold, wet. When it's cold and wet, we turn up the heat. When we turn up the heat pulls the fluid out of the air. When it pulls the fluid out of the air, it dehydrates us a little bit, causes our joints to decrease in function. We're going to decrease our fluids in our body unless we're keeping up with it, right? Drinking all that water. And I'll go into videos at some point about water and how much you should drink and what is too much, what is not enough. Right, so I had a patient yesterday actually that has pretty significant arthritis, and I'm like, well, how much water do you drink? She's like, water, I hate water. I'm like, you have to drink water. You have to drink water. Your joints are incredibly changed, right? You have multiple this, that problems. You have to drink water to keep your body flush. You got to flush your tissues. You got to hydrate. Your body uses your fluids to hydrate you. It pulls off the electrolytes and it hydrates your body. So that's for another topic. So with mechanical, the loss of range of motion, the limitation of movements is typically progressive. So you'll maybe have no problem going up 8 steps, but then going up 10 steps is a problem. And then maybe going up 6 steps is okay, but 8 steps is a problem. 3 steps and then 2 steps is a problem. So it's a progressive thing where it's going to typically increase your inability to function. So you'll be doing less and less. Instead of walking a block, maybe you can only walk half a block or a quarter of a block. Or if you're walking in the mall, maybe you can only walk 5 stores. Now you got to sit down, right? As opposed to walking the mall as exercise. Because some patients do that in the mornings. They walk in the malls for exercise. It's nice and warm, and people do that. So it's going to progressively increase your ability to function. Some patients complain about stiffness in the morning, which typically holds for a longer period of time. And severity increases over time as your cartilage is starting to wear and wear and wear. So what do you hear? I'm going to play a video of the sounds of arthritis. So the sounds of arthritis that you typically hear are cracking, scraping, are the typical sounds, and the crepitus, all types of crepitation type sounds. Usually generated when you move. So when you move, you hear a pop or a click or that cracking, and that is the irregular surface of your articular joints. They have poor quality, and it's affecting your cartilage, and that's what's causing the crepitus in the joints or the cracking in the joints. So when we talk about osteoarthritis, there are typically 4 stages of osteoarthritis. Stage 1, which we'll consider the minor stage. Typically, a person with osteoarthritis at stage 1 has very minor symptoms, maybe a small bone spur, maybe it causes some slight irritation and some slight pain and some slight changes in your cartilage. Very minimal, typically. Doesn't really cause you that much decrease in function. Stage 2 is, we'll call it the mild stage. Typically in stage 2, you'll have more bone spurs. spurs. You'll have more cartilage wear and tear. It's still healthy, but you're starting to get that wear. You're starting to get that change. Typically, the space in the joints usually are decreased, right? So when we have a nice big joint articular space, our body can function. And when the space starts to decrease, the ability to function decreases and the joints start to get wear and tear. So let me just tell you a little bit about how the knee actually gets arthritis. How the knee gets nutrients. So we have our knee joint, and if you ever notice, there's no blood vessels in the middle of the knee joint. There's no blood vessels. So how does the fluids, how does anything happen? So on the sides of the joint, through osmosis, which simply means the fluid comes in from the outside of the joint, and there's membranes and tissues that are porous and pull the fluids into the joint. How smart your body is. Pretty cool, right? Because if you had blood vessels in the middle of your knee and you tore it, you'd be ripping blood vessels in the knee. Now there's blood vessels behind the knee, right? But through the knee joint itself, there's not. That's why sometimes when you have a knee injury, you'll get what's called a Baker's cyst. So a Baker's cyst is usually when you rip or pop your posterior ligament, and then you form a sac. And the more you move, the bigger the sac gets. When you rest it, it starts to decrease. You've popped one of your ligaments, and it fills up with fluid in there. So typically, again, in stage 2 on X-ray, we're going to see those greater bolt spurs. We're going to see the space decrease. In this stage, people are going to start really feeling pain. In stage 1, they really wouldn't feel pain. Stage 2, the mild stage, they will feel pain. And they can feel it sometimes after a long walk, or if they went for a jog, or if they went running, or if they were doing any kind of activities, they would feel it by doing some slight activities. Now, stage 3 is when it really starts to get cooking with arthritis. So in stage 3, that's considered the moderate stage. And in the moderate stage, your cartilage between your bones show obvious damage, and the space between the bones significantly narrow. People in stage 3 osteoarthritis are likely to experience frequent pain, especially when walking, running, bending, kneeling. Those are typically my patients that go up and down the stairs and have problems and have progressive problems. They tend to experience pain for longer periods of time. So where in stage 2, you might feel it for a half hour here, 20 minutes there. With stage 3, you might feel it for 3 or 4 hours or even longer for pain. And even more pain in the morning when you wake up. Tends to cause you even fatigue and sleepiness, right? Because your body is swollen and your joints are affected. So your body's working extra hard to counterbalance that. Our body's always working, whether we're sleeping or we're moving, our body is always working. So now you add an injury to it by adding inflammation and pain. Now your body has to work harder and harder. The harder it has to work, the more nutrients it's going to pull into those different areas to say, hey, I got an injury here. Let's send all our troops down to whatever area is injured and where the inflammation is. Now, if you have systemic arthritis, you have it in your hands, you have it in your knees, you have it in your ankle, imagine your body's working extra hard, and that's what makes you typically sleepy and tired and fatigued. Okay, stage 4. It's the most severe, and it's actually called severe arthritis. This is when you are in pretty much constant pain. You can't walk that far. Your ability to walk up and down the stairs has been significantly affected. The motion in the joint is significantly reduced. And you might even walk with a straightish leg, right? You're not bending it, or you might bend it like 20 degrees, 15 degrees, where you should be bending it 5 times that. And we accept this. So people accept this over time because it happens slowly, right? So when it happens slowly, we don't think about it. We accept these little limitations as we get older. Oh, that's just age. That's just age. That's just age. It's just age because you have accepted it. Right? I have plenty of patients that I know that are 80, I know 82 years old at the gym, doing weights, doing exercises on the elliptical next to me. Why is that person there and you're not? What makes them different than you? Maybe they started when they were younger. They say, oh, they had better genes than me. Maybe it's the life choices we have throughout our life and what we've done with them. Because their path might be different, but they've all had struggles. That person I know had many, many struggles of many different conditions. But he takes care of them, takes care of himself, eats well, exercises, hydrates. It's critical, especially as we get older. So severe stage 4, a lot of cracking and popping, decreased motion. You can't bend the knee. You can't bend it the way you should all the way. You have very, very limited motion. You might have big spurs that are sticking off your joint, actually deformed your joint now. The fluid is in your joint is really causing friction and it's rubbing hard and it hurts. And that's why it's inflamed and red. Maybe when you're walking up and down the stairs, you're walking sideways or you're walking down the stairs backwards. I never knew that existed until I had multiple patients tell me that's the only way they can go down the stairs is backwards, which obviously is a bigger problem, right? If they take one wrong step or they could fall, break a hip. And that's now a bigger problem. So my message for arthritis is start understanding it early. Try to take care of yourself. So what could we do? So typically with arthritis, what is the first thing that the medical community will do? They're going to put you on NSAIDs, non-steroid anti-inflammatory drugs like ibuprofen or naproxen. And they're going to talk about different therapies. We're going to talk about chiropractic, physical therapy, keep your joints moving, right? So earlier you start chiropractic and the earlier you start physical therapy, the better your joints will function because we're going to put you in that proper motion. We're going to get you back functionally, structurally where you should be. We're going to try to help keep you along better. I'm going to put it to you like this. If you ever had a car that your wheel alignment felt off and your tire on one side was worn, right? So you're bald on one side. What happens over time is, just like our knees, I'll use the knees as an example, you're going to wear incorrectly. And then maybe your right tire was perfect, but in 6 months, now you need 2 new tires. Because that worn tire has affected your other side completely. And your ability to function has completely changed. When we put you in alignment and proper structure, proper function, strengthening, we change that. That's one of the big things. Other things that the medical community will eventually offer you is surgery, right? Joint replacements, never a great option. They might offer you cortisone injections, which is a temporary fix. So cortisone, it's amazing at reducing inflammation. Amazing at it. It does it. Takes away some pain, takes away inflammation. For how long? Some patients, reducing inflammation, it could be for a week, some for a month, some for 6 months. Everybody's a little bit different. But at what cost? Right? It's a cost. What's the cost? The cost is by the method that it takes away the inflammation, it stops the flow of fluid to the area. When it stops the flow of fluid to the area, that area becomes drier. When that area becomes drier, what happens is causes more friction. When you cause friction in a joint, you have increased wear and tear. So that hyaline cartilage that's around there, that smooth cartilage gets worn. So while you've taken away a temporary pain, you've actually worsened your knee. Think about that. Which is why the medical community will only do 3 injections per year. What happens if you do more, I've seen it with less than 3, is you tend to tear your ligaments around the joint. Really? You tear your ligaments and they're putting this into you? Yes, you tear your ligaments. Why? It dries out the area so much and makes those ligaments frayable, meaning they tend to rip. Right? So the drier they become, the easier you can to rip them. And once you rip them, now you have another problem. That's typically what happens with cortisone. That's why they will only allow you to do 3 per year. But they do have their protocol of cortisone. And then you can do gel shots. Gel shots are what I'll call WD-40 for your knee. That's what gel shots are, right? So if you have a squeaky door, you put the WD-40 on, squeak goes away. When you have osteoarthritis in your knee and you put a gel shot in there, some patients it goes away for a little while, 1 month, 2 months, 3 months. Some it doesn't, but it's temporary. It's a very temporary solution. You're not causing change in the root of the problem, right? You're not making a biomechanical change. You're making a temporary patch fix. And again, surgery is always the last option. Once you have surgery, you can't go back. Anything else you typically can. I always say do everything in your power before any kind of surgery, because once you're cut, you're cut. There's no going back. So I usually say throw everything against the wall, do it as best you can, do it as long as you can to prevent yourself from changing. Some patients, surgery is the only option, right? So I'm not poo-pooing surgery. Some patients have done very, very well and they needed it and it worked for them. But every person has to weigh their own pros and cons of what works for them. Everybody's different and has to deal with their own consequences of whether they do surgery or not. Sometimes you can have do-overs if you don't do surgery, right? You could always, surgery is always on the table. But I always say do as best you can to do the most non-invasive, right? Chiropractic, physical therapy, typically the most non-invasive. Do as much as you can, get the most out of it. If the person you're with is not doing the things that you think you should be or you shouldn't function, there are others out there. There's a lot of different techniques for a lot of different people. Some people do better than others. There's good and bad at everything, right? But you as the patient also has to do your part, right? So us as practitioners can only do X. We can only do our part. There are many, many other hours. So if you're in our office 3 times a week for 1 hour, there's another 47 hours in between visits that we don't see you and things that you do in your outside world. A lot of hours in your schedule. You have to choose wisely and do the things that you're supposed to do to help you function. That's critical. Osteoarthritis, you have to take some responsibility for doing tasks. Again, no staples, easy button. You have to actually do the work. Not everybody wants to do the work. Some people rather say, I want to, you know what, just give me the quick fix of surgery or this or that. I hate to tell anybody, but surgery is never, ever, never a quick fix. It's the longest, hardest, usually, path. And it takes time. It still takes time and energy. So I always say, put your time and energy in now. Try it now. If it fails, look at your options. One of the other things that we'll talk about of natural solutions, right? Biggest thing we're going to talk about is diet. You have to have a good diet. Anti-inflammatory type foods. What are those? Berries, fatty fishes like salmon, nuts, seeds. Those are all good natural anti-inflammatories. Things you want to avoid, processed food, right? Sugary snacks. Anything that has extra sugar in it, or we'll call it fake sugar, and you know what that is. You know what that is. It's sweet, but how is it sweet? It's sugar-free. Think about that. It's processed and probably banned in other countries, but not banned here. So think about that. You want to avoid a lot of red meat. And you want to typically hydrate. Lots of water, help flush out the toxins in your body. So usually the rule of water, I'll just tell you, is usually half your body weight in ounces. So if you're 200 pounds, you should drink 100 ounces of water. Very simply. 100 ounces of water is approximately 12 glasses of 8 ounces of water. Approximately. Supplements. What are some good supplements that you could take? So glucosamine and chondroitin sulfate together help with joints, joint stability, joint function. Omega-3 fatty acids are great for taking down inflammation. And the last one I typically would suggest would be turmeric. The combo of all three definitely helps joints. Will it cure the joint? No, it helps. So everything you do will be stacking your chances to do better, right? So you're gonna do your therapy. You're gonna change your diet, eat well. You're gonna hydrate, and you're gonna eat your supplements. All building the path of a good functioning joint. Next thing we should talk about is exercise. Low impact exercises. What's that now? Swimming, cycling, light walking, and I would actually even suggest more of an elliptical. The elliptical is typically made for a low impact, non-joint, and it's a great exercise for that. And also, we got to build some strength, right? We got to use some weights and do some weight training. You don't have to be the Hulk or Superman, but you got to start slow. So start whatever weight works for you so you could function. And it should be low amounts of weight so you can keep your repetitions up. No one's looking to enter any contest, right? So you got to start smart. That means starting with 1 pound, start with 1 pound. That starts with 3 pounds or 5 pounds, whatever that is. Do what works for you that makes you comfortable and safe. That's the key part, right? You have to actually finish the exercise. That's the key part. Flexibility exercises. What's good? Yoga, Pilates. Those are great exercises to maintain joint motion and flexibility. Another key part, and this goes hand in hand with your diet, is weight management. Obviously, the healthier we are, the more we function in a better manner. The lighter we are, the more we function in an easier manner. Our joints are maintained better when we function better and when our weight is managed. What are some herbal remedies to help with joints? Ginger. Ginger is known as an anti-inflammatory. Boswellia, Boswellia. It's typically known for reducing inflammations. You check out some remedies in my book, The Complete Herbal Guide. Check it out. There's a lot of great remedies in there. Other things we can do, hot and cold therapy. Typically, I'm a big fan of relaxing the joint. And in order to relax the joint, we're going to put heat. When the joint is hot and swollen, we're obviously not going to put heat. We'll put cold. Always have a layer in between you and whatever you're using. No more than 15 minutes. That's the max. Give it 2 hours of a break after that. Mind practices, that could be meditation, reducing your stress, some Tai Chi, great gentle movements that improve balance and function. And there are other solutions out there. Regeneration medicine, which I will talk about another time. I do have stories on it, which I've seen tremendous changes in patients. I've seen changes in me. Regeneration medicine, I will cover at another time, but it really has changed me significantly. With that said, that is pretty much everything you need to know about osteoarthritis. This is episode 1 of 4 in the arthritis series. And what I will say to you is, it's your life. Be there healthy because health matters. Thank you. Have a great day.